Okay, I think we might be live, but I don't know. Hold on a second. We are. Okay, cool. Hello, everyone. Facebook land or internet land or wherever this is going out to. It's actually quite entertaining for me to to see how all this technology works or doesn't work. It's great when it does, but however, anyways, okay, we're gonna. My name is Bill, the Knee Pain Guru, and I am here from World Headquarters, Knee Pain Elimination World Headquarters here in Barnardsville, North Carolina. Today we are going to talk. I got a bunch of questions this week. I've been doing these live streams the past couple days. I'm getting more questions in, more interaction, which is great. It's fantastic. However, they need to be answered. So that's what I'm going to do here. I got them in my inbox here. Question here from Noah about how to deal with a knee sprain. I recently spent the weekend in Chicago and did a lot of walking. The next day, muscles along his shins were really sore. Felt like joint pain around the knee. Feel fine with my leg totally straightened and walked, which isn't how you should walk, but I'm sure I noticed the pain wasn't really there when the leg was straight. Once I gave it a rest and went easy, went on for the next week, pain went down a lot and could function pretty normal. Thinking it's pretty much gone. Went ahead and started using it again, lifting things and raking leaves, putting pressure on it. It flared back up, and this time it really got bad to the point I couldn't move my leg. Bad with even out it hurting super bad. By morning it went down, and some each day, I guess a little, but it has been a week since, and it is definitely still there. Definitely feels like joint pain or bone pain if I had to guess. Never had an injury like this, not sure where it came from. Didn't think walking would do it, but guess it did. Just wondering if there's something I could do to speed along the recovery, and or should I have it looked at if I'm not sure if it sounds serious or something I can take care of it on my own. Go get it looked at. Have a doctor give you a diagnosis, and then we can go from there. Once you know what you're dealing with, if it's just a sprain, then we're only dealing with pain. It's real easy and straightforward as far as to give you an answer. All of that other stuff, you're walking and how it got worse and it got better, that's really irrelevant to what we're really needing to deal with. Yeah, I don't like talking about fluff. Let's get to the real issue, which is your knee has pain. Let's get it out of pain. Go to the doctor, get it checked out, find a good orthopedic surgeon. I actually have a blog post on my website about finding a good orthopedic surgeon with actually a list of places to contact. So go to a local professional sports or collegiate athletic program, find out who they use for their athletes, go see the doctor. One, the doctor's not going to need the business, and two, they're going to be really good. So they're not going to give you something to do just because. They'll be real straight with you as far as what you have going on. So Noah, go do that. Let me know how it goes. Next question is from Luke. It was one of the Q&As I did earlier this week. Knee pain when kneeling. Hey Bill, thanks for your video. Wanted to ask you how I can support the healing process of a torn meniscus. It was stitched 3 months ago via arthroscopy. A few weeks ago, I started to ride my bike. The big thing is addressing the tension pattern. When there's pain in the knee, when there's surgery, both of them are trauma to the knee joint. And what ends up happening is the body compensates for that, for the trauma, and it creates this workaround, a neurological workaround that kind of keeps the pattern that got you injured there longer. So working with what I refer to as pain pattern interrupts relaxes the tension in the joint because we're getting the pressure off of the nerves. And when we get the pressure off of the nerves, it's a relief in the joint. The joint relaxes, it expands. which is comfortable, which creates more space, which is more comfortable and expands and creates more space. So it essentially shifts your nervous system state and sets up the conditions so your body is now able to heal your knee. That's going to create the space in there. Then we got to add in, make sure you're drinking plenty of water. You want to check out the original Gatorade post I have on my website. Looking at nutrition, check out the bone blog post I have, a bone the recipe for rebuilding joints, as well as looking at supplementation, certain supplements in terms of to help the meniscus heal faster. So that would be my strategy. Let's see. Question here from Blaine. Is your approach just a temporary relief, or is it permanent for bone-on-bone osteoarthritis disease? There's a couple different misconceptions. The wording is not accurate in your question. So it's important to look at the question. Are you looking for relief from the pain, or are you looking to make sure you're bone on bone? If you go to a doctor, they're not going to diagnose you with bone on bone arthritis. Two different questions. If you want to get out of pain, my program is going to get you out of pain. If you want to heal bone on bone arthritis, I believe your body can do that. We have to set up the conditions for it to do so. But my question to you is, would you care what your diagnosis is, bone on bone or osteoarthritis, if you weren't in pain? 99 out of 100 people would say no. They don't care. So my program gets you out of pain. Now, will that be temporary, or will that be permanent? Like everything else in life, everything changes. If you take your car in, you get your oil changed, or the check engine light comes on and then you get it fixed. Is that temporary, or is that permanent? You know, we have to do maintenance on our bodies as well as everything else in our life. Our cars, our houses, our relationships, our animals. We have to do maintenance on everything else. So it's not logical to think that we do something for our knee once and then it's good forever. And I think that's a belief that many people suffering with knee pain have, and that keeps them stuck in pain because they think they're going to go to a doctor and get a drug, a shot, a surgery, and then they don't have to think about their knee anymore. And the reality of it is, our body is always changing. We're putting food in our mouth every day. We're putting water in our bodies every day. We're moving. We have stress that increases and decreases every day. Changes constantly take place. So our body is constantly changing. So we constantly have to do maintenance on it. So I don't know if it directly answers your question, Blaine. However, it really, and that's one of the things I cover in my program, is the mindset piece. The mindset, I could get people out of pain pretty quick. It's the mind that keeps people stuck and going back into old patterns that throws them back into pain again. So you might want to check that. That's going to be the biggest, highest leverage piece to look at. Okay, question here from Carol. My son injured his knee about 3 years ago. Most recently, I had to take him to the hospital because his knee was in unbearable pain. Doctor drained the fluid. Now it has gone to his other knee. His knee is so swollen it has gone down to his whole leg and ankle. They are extremely swollen. I took him to a doctor again. He thought it was a Baker's cyst and thought there is fluid behind the knee. He did not want to mess with it as he was not quite sure about the diagnosis. The doctor sent him to an orthopedic doctor. He said he did not know either, but thinks it might be arthritis, so he sent him to an internal doctor. His knee, foot, leg are so swollen that he can't hardly get his jeans on. The pain, he cannot stand. Cannot see him cry, as I have never seen him ever hurt this bad and in so much pain. They know, I guess, it is inflammation by something about the white blood cells, but there isn't something they can do that they are not doing. Gosh, there's a couple directions I would point you to, Carol. One was I would check with a functional medicine doc. Do a search on that. Check with an osteopath, and an osteopath that specifically deals with manual manipulation. There may be some benefit in going in those two directions in terms of what you have going on. So that would be my answer to what you have. Question here from Edgardo. Hey Bill, can you send that link not attached to Facebook so I can watch the video? I don't have a Facebook account, thanks. Edgardo, I apologize for that. That video that you're referring to was I only did it in Facebook. I don't have it outside of Facebook. So unless you have a Facebook account, that's the only way to see that one. So I apologize on that. Since then, I figured out the technology with the whole YouTube thing so I could post it on Facebook as well and all that kind of happy stuff. Okay, Penny, pros and cons of arthroscopic surgery. It was one of the blog posts on my website. My website, by the way, is thekneepainguru.com. You can check that out. Penny says, I was accidentally kicked on my inner knee about a month ago. Initially, I couldn't put any weight on it and used crutches for about a week and a half. Now I have pain, tenderness on my inner knee and some pain and weird pressure on the outside of that knee. The pressure on the outside of the knee feels as if there's something pushing against something else. I had an MRI and it showed a meniscus tear on the inside of my knee, having surgery in a week. I want to know, is it possible for something else to be wrong and the MRI just didn't pick it up? If so, would the doctors be able to see it during surgery? Did I explain the weird pressure? I did explain the weird pressure and was told that the MRI didn't show anything. Penny, the knee joint, first of all, you have a meniscus tear. That's good. You went and got it checked out. You got the MRI. To know what you're dealing with, the doctor's going to address that, which is fantastic. But what happens is when you get kicked on the inside of the knee, let me make sure I am centered here in the video so you can see this. When you get kicked on the inside of the knee joint will kind of go like this, and it'll hold a pattern to protect itself from the injury, from the threat, from the trauma. And what ends up happening is the body latches on to that trauma, that tension pattern, to protect itself. And what ends up happening is that that's functional for that injury to protect the knee from tearing worse. So the meniscus could have torn more as a result of not grabbing on like that. That pattern is functional for the injury, however, dysfunctional for you to go back into your life and move around without feeling that weird pressure. So here's what I would suggest. Go do the surgery. Get in touch with me after the surgery. We'll have a conversation. We'll figure out how to speed up the healing process in your body post-surgery, as well as get that weirdness out of your knee. So I am going to go, being that this is on social media and stuff, I'm going to see if there are any questions. Chat. Doesn't seem to be any questions, and that is cool. I'm going to post this on, this will be on my Facebook page, the Knee Pain Guru Facebook page. This will also be on my YouTube channel, the Knee Pain Guru YouTube channel. So this video will be in those two places and maybe floating around the internet some other special place. For more information, go to my website, thekneepainguru.com. Check my Facebook page out, the Knee Pain Guru, my YouTube channel, the Knee Pain Guru. I don't have anything fancy. It's pretty straightforward. Thank you so much. This is Bill Paravano, the Knee Pain Guru, signing off for today. Have a wonderful rest of the day. And for all of those that asked these questions, I will post this link in the response to all of your questions. Thank you so much. Have a good day.